Good morning. My name is Barbara Campos. I'm a shoulder surgeon from Lisbon, Portugal. Greetings from Lisbon. I would like to take a moment to thank Professor Bernoulli and the rest of the organizing committee for this kind invitation. I'm very glad to take part in this course and also to congratulate them for adapting so quickly to the strange situation we're all living in. So we're talking about improving visualization, limiting bleeding during arthroscopy. I have no conflict of interest in this talk. So is this possible to do, to improve visualization during shoulder arthroscopy? Yes. Hopefully I will give you some tips and tricks in order for you to be better in the OR. So shoulder arthroscopy can be stressful for nurse staff in the OR. There are 100 tasks to be done, and surgeons seem to be stressed. We are ever so demanding. Why? The thing is, shoulder arthroscopy is in fact complex surgery, and we're doing some complex things under arthroscopy nowadays. And the best way to do it is by completing little steps. And for this, it is essential to see. On open surgery, we use spreaders to see, and under arthroscopy, we need good visualization. Every little detail counts in this type of surgery, and the road to success resides on those small details. This has teamwork written all over it. It is not a one-man show. An enthusiastic permanent team is the best thing to have on shoulder arthroscopy. Preoperatively, you can start by thinking of blood thinners, a single drop of blood mixtures with water, and under arthroscopy, we'll get from seeing everything perfectly to seeing almost nothing. So you need to have the patient stop blood thinners before shoulder arthroscopy is done. Conventional ones are very easy to remember. So everyone remembers these ones, and it's not a problem here, but you do need to think of unconventional ones as well. Goji bags, turmeric, ginger, garlic, and bromelain. And the patients must stop these things because often they take them and they don't know that this will hurt the visualization of the surgeon during surgery. Then your material. You need to know your material very well, starting with arthropumps. They serve to distend the joint and as well to clear the blood and other tissues from the visualization field, and you must be familiar with it. Which is being used, inflow and outflow, and which are the options you have for rinsing, a remote control, a pedal. Optics, which one is being used, 30 degrees, 70 degrees, sometimes both, and check before if they're not scratched or broken or anything. So in which sheet is the optics running? I do like this high flow sheet that has this extra rows of little holes so that the fluid can get in more effectively. And in shoulder arthroscopy, of course, we need a lot of debridement. So you'll need a shaver and a radio frequency, and you must know which does the surgeon like to use better, a pedal, a remote control. So know these things before surgery begins very well. Let's get into fog. We all know what fog is, small particles of water condensating on a surface. And on arthroscopy, we do have this as well because we do this movement a lot. And small holes open in the plastic bag, the water gets in and then it condensates inside. So how does this bother us during surgery? Why, more or less as when you're driving your car. It's a sunny day and you see everything perfectly well and everything is fine. But then a little fog comes along and you don't see that nice anymore. You're starting to struggle to see what the structures are. And this actually can get a lot worse. So now you're struggling to see what the structures are. It's almost impossible to continue. You're starting to consider to pull over your car, otherwise you might crash. And on surgery, this is dangerous because this can compromise the success of surgery. So we need to prevent this fog. The best thing is to have autoclavable cameras, but this is quite expensive and not every institution has a set of cameras to do one day of arthroscopies. I don't. So I do need camera drapes. This one is the single best camera drape I found. It is very easy to assemble it. You just connect it like this. You will have virtually no fog, but if you do, during surgery, you just disassemble it the same way. You clean it with a swab and you're ready to go. If you can't find or buy this fancy camera drape and you're stuck with this regular one, this is a trick that will help. You'll just need this extra suction tube and you will connect it to the camera like this. And then you put it inside the camera drape and you leave the suction tube just hanging there. Don't connect it to nothing. And if fog occurs, you will connect it to the vacuum and it will happen something similar that when you're using your car, you turn the AC on and no more fog. And on the top screen, you're seeing something resembling a rotator cuff, a biceps already cut, but the image is not quite good. And then you turn the suction tube on. Voila, we have image again. We can go on. We lost some little time, but we didn't lose the time to set the whole thing up again. So this is a very nice trick. Intraoperatively, surgery begins, and we do not want to see blood during arthroscopy. So anesthesia is the single most important factor, and surgeon-anesthetist relationship, it is very important. The best is to have an anesthesiologist that wants to do this kind of surgery, and he understands the concept of hypertensive anesthesia and the techniques behind it. He needs to understand that this top screen is not hypertensive anesthesia, and this can be responsible for some peaks of hypertensive situation that makes the shoulder bleed. You need to be comfortable with interscalene blocks to control the pain and know that actually the complication rate is very low. Be familiar with tranexamic acid. I do use it. I think it improves visualization a lot. And some centers use epinephrines in the bag. I don't use it. I think it can cause hypertensive rebound, and I don't like to use it. So of course, when all of this does not go as well as we planned, there can be some frustrating moments and even some conflicts with prolonged times of surgery and higher volumes of fluids being used. So where can you be helpful? A lot. You can be proactive, look at that screen, check the tension, talk to everyone in the OR, including the anesthesiologist, try to help control these little variables in order to leave the surgeon concentrated on surgery itself. So we talked about anesthesiologists understanding our point of view, but we also need to understand theirs. So cerebral hyperperfusion in the beach chair position is a reality, and we do know for every 2.5 centimeters of head elevation, there's a drop in cerebral perfusion. So for this reason, I've completely abandoned the classic beach chair, and I do my arthroscopies under this NIS or lazy beach chair, and this gets the anesthesiologist much more at ease with hypertensive anesthesia. Cannulas, some surgeons like them. They make the workspace bigger theoretically, and they make passage of instruments in and out easier. They can make visualization better because they have a designated outflow. And if your surgeon is using them, you have to be attentive of this in and out maneuver. So you need to grab the cannula for the instruments to get in and out, and this can be very helpful. If you do not use cannulas like myself, it is very important to understand this concept, the Bernoulli Principle from fluid mechanics, and we've all experienced this during our lives. So in the shower, as the fast current of water is getting out of the shower, it creates a negative pressure that brings that curtain towards our body. So the curtain is sticking to our legs. Everyone has experienced this. And this is because of the suction effect towards that stream. Burkhardt elegantly explained this in arthroscopy in 2001. How does this principle apply to shoulder arthroscopy? So as the fast exiting fluids are getting out from those portals that are not being used, blood cells are literally getting sucked from blood vessels, and it mixtures with the water. We don't see properly, And if we try to increase inflow in order to see better, it will actually get worse. So this makes visualization very bad, and we need to stop this turbulent flow. So to do this, you need to put a finger on each portal that is not being used. Don't let that water get out. So take home message. Finally, this is stressful surgery and it can be hard on nurse staff on the OR. You need to keep it cool. This is great surgery and we do need you a lot to do this surgery correctly. Blood thinners, think of them, have the patient stop everything before surgery. You have to know your material very well, from arthro pumps to shaver to optics, everything. You have to manage the fluids very correctly, and you need to prevent fog with those tricks that I taught you. The relationship to the anesthesiologist is very important. You can be proactive by controlling that tension. And at least for last, you need to put your finger on each portal that is not being used. Thank you for your attention.